What's going on, guys? Rolandas here. Today's topic is going to be oral minoxidil. I had a lot of requests to cover this topic because I'm planning to start it myself, and actually today is going to be the day when I'm starting it. So I was thinking there's a perfect opportunity to put together this video. For those of you who are new here, I had hair transplant done just like recently, like 10 days ago really, and it was my second hair transplant with Dr. Bruno Ferreira in Portugal. Overall I had 6,540 grafts implanted all over my Norwood 5A area. Over 2 surgeries. So I'm still recovering. Today I completely removed the scabs and it looks already pretty good. So I'm gonna show you everything, how it looks tomorrow. So make sure to subscribe to the channel if you haven't already. Like the video if you're enjoying this kind of content. And yeah, let's jump into today's topic. So why oral minoxidil, why not topical? For starters, I used topical minoxidil for 1 year together paired with microneedling to enhance absorption and overall results before my first hair transplant. And I know exactly what to expect. It did give me pretty good boost, to be fair, but it was not enough to avoid like a second surgery. It was actually far from, being great, but it works, of course. But I want to try oral because it's so much more efficacious and a lot of people are experiencing so much more results overall from oral minoxidil, even on the lower dosages. So I just wanted basically to try out for myself and see how well I can respond to it in terms of side effects and efficacy, of course. So here are some pictures just to show you how well I responded to topical minoxidil with microneedling together. This is my baseline basically, that's before I started any hair loss treatment. It was late 2018, yeah, Norwood 5A basically, pretty much. No front, just very minimal. I had a super long hair, I was making like rocking a proper comb over. So yeah, pretty much like 99% of the front is gone. There is a little bit of hair in the mid scalp that are pretty long and some of them in the crown. So yeah, that was my baseline. So this was after 6 months of topical minoxidil and microneedling. I'm gonna link in the description down below Hair Restoration Network forum topic that I started when I was documenting my whole journey with minoxidil and microneedling. So I posted a lot of different pictures. If you're curious, just go ahead, check it out. But yeah, anyways, that was 6 months. And yeah, as you can see, mid-scalp, front, there is obviously nothing, it was bare, there was no hair, it's impossible to do anything. But mid-scalp and especially crown improved a little bit. Of course, the quality is a little bit, can be a little bit different in the angle, but overall, like the main difference was on the crown and this lateral humps that were already strong anyways in the previous picture, but they kind of improved as well. But yeah, nothing super major, it was 6 months. This picture is 9 months being on a treatment, so yeah, as you can see, really no like that much of an improvement. Kind of let the hair to grow longer, much longer than they could have without minoxidil and microneedling. Overall, like again, crown a little bit improved and slightly the lateral humps. And maybe a little bit more, the thin, fine hair that was in the mid-scalp, maybe they kind of thickened up a little bit. And thus creating this like slightly more illusion of density, if you can say, but again, nothing really substantial. Like it's far from avoiding a hair transplant. Hence why I took even this decision to stop minoxidil altogether and just get on and do the transplants, as to fix everything, and then just go back and basically to kind of keep it as a maintenance basically protocol. This is a 12-month result of my microneedling with minoxidil, and this is what I had. I've been 6 months on finasteride altogether. So yeah, more improvement, but again, it's mainly like because of the angle and the way I brush the hair, but it was not really that much. Again, the hair just got longer, and of course, this miniaturized hair, especially in the mid scalp, they got much. They were able to grow much longer, and they became slightly thicker, and because I had quite a good amount of them that were really miniaturized. They really benefited, to be honest, and they got a pretty good boost. But again, nothing substantial to avoid the surgery altogether. It looks like it's just on one side, but it was pretty much the whole mid scalp because I just combed kind of in this awkward way. So I think I responded pretty well to topical minoxidil compared with my microneedling as well, but I think I could respond even better on oral minoxidil. And you know what, I weighted pros and cons, and I'm willing to take this risk to try out. If it doesn't go well, if it's not gonna work out, I'm just gonna jump back on topical minoxidil because I know it works for me. So if you haven't tried topical minoxidil before and you are thinking maybe you should try go straight away to oral minoxidil because it's much better, I would advise you to actually start from topical first, because you never know, maybe you're gonna be a hyper responder, and you know, not everyone actually needs. Like the oral minoxidil is much more dangerous, let's say, compared to topical. Topical is like available over the counter, like in most places all around the world, you know, especially in the UK and the US, like you can buy it anywhere, you know, very easily. It's pretty cheap as well. The only negative of topical is just, you know, the hassle of applying it, and they suggest twice a day, but it's once a day, it's more than enough, because when you're applying topically, it stays on scalp. The half-life on the scalp is around 22 hours, if I remember correctly, so yeah, once a day is pretty fine. And my suggestion would be to try the foam version versus liquid. The foam version is overall in my eyes more superior. It's drying much quicker. It doesn't like make your hair like look super greasy and whatnot. And use liquid only if you want to use something like a very special formulation, let's say more percentage of minoxidil, like 10 or 15% of minoxidil, or if you want to add some tretinoin for better absorption or etc. Like only in such cases. But it's the best just to start from a basic like a Rogaine or Regain, or even like a brands like Kirkland. It's absolutely fine. The brand doesn't really matter that much. So I mentioned briefly that it has more potential side effects. But what are those, if you are curious? And I actually found here like a leaflet from NHS in UK, which NHS is a National Health Service. So they are basically describing how to use oral minoxidil for hair loss in both men and women, but they are suggesting like super low dosage here. But they're also talking what kind of potential side effects can occur. So let's have a look. Fluid retention, causing weight gain and or ankle swelling, increased heart rate, fast pulse or palpitations, heart palpitations, pericarditis or pericardial effusion, causing chest pain and or shortness of breath, low blood pressure, obviously because that's a blood pressure medication, may cause dizziness and fainting, increased body hair growth, skin rashes, nausea, vomiting, breast tenderness, blood test abnormalities. The most common side effect of oral minoxidil is extra body growth. Most cases it's gonna make you grow body hair like all over the place. So hence that's why most women are not okay with using, you know, oral minoxidil. They prefer topical because, you know, like for women, growing body hair is not really a great thing. Personally, I don't mind. As you can see, I have zero beard anyways. If I will manage to grow a little bit, that would be great. Although, some people suggested, why don't you start topical minoxidil on your beard for beard growth? I tried. I did it together with my, you know, scalp. I put, you know, on my beard. Didn't do much because, you know, there's no follicles. From my research, oral minoxidil, both side effects and efficacy are extremely dependable on the dosage. The common doses prescribed for blood pressure, for hypertension, are between 10 and 40 milligrams, like 10 and 40, that's quite a lot. And the maximum dose of oral minoxidil for hypertension was like up to 100. They're usually starting from 5 milligrams per day, and they're upping their dose up to 40 milligram per day as a single dose, depending on like on a person to person, to effectively, you know, control the hypertension basically. But for hair loss, the doses are much lower actually. So the surgeons who are prescribing oral minoxidil, most of them they prescribing in doses of 5 milligrams per day. And this dose has been shown to be very effective for hair loss, while still managing like a side effect profile pretty well, like without any extra like a heart palpitations or etc. Mainly just with the increased body hair growth, and that's it really. But other surgeons, so for example, Dr. Bisanga, you know, he's prescribing 5 milligrams per day. Dr. Ferreira also suggested for me to use 5 milligrams per day if I want to try oral minoxidil. And other surgeons, like for example, you know, Dr. Bhatti, he is actually proponent of very low dosage of 0.625 milligrams twice a day. So because the half-life of oral minoxidil is about 6 hours only compared to topical when it stays on scalp for about 22 hours. So hence why he suggests to take it twice a day. But any other surgeon really recommends like only once a day. From my research, from what anecdotally from what people are usually taking, the lower the dose, the less side effects, and the more you're increasing the dose, the more possibility of side effects. So personally, I've got the oral minoxidil Loniten brand, which are 5 milligram version. So I have decided to start from 1.25 milligram dose, which is still pretty low. It's on a lower end, but still quite a lot of people, anecdotally, it's worth mentioning, they have still quite good success, to be honest. And according to the side effect profile, from what I've seen, from this dose, it's like the best tolerable, basically. Like, people have zero side effects. So I think it's the best dose to start, and that's what I'm gonna do. So there are, of course, a couple of things I'm doing to prepare myself basically to start, this drug. Since oral minoxidil is actually a blood pressure medication, it's important to actually establish your blood pressure baseline. So that's what I did. I bought off of Amazon some cheap, basically, thing to measure my blood pressure, and I've been checking my blood pressure for the last couple of days, a couple of times a day. And yeah, so far what I found is that my blood pressure is on the normal range. So my only downside probably might be, if I start oral minoxidil, is that my blood pressure can actually go lower than normal. What's the danger of low blood pressure? It's, to be honest, not really much. The only thing that you can feel a little bit like a dizzy, and you can faint. Of course, like it's not nothing, but nonetheless it's not as bad as when it's like a high blood pressure. So yeah, if you're planning to get on oral minoxidil, definitely check this out. Either get yourself a machine like that so you can actually monitor your blood pressure, because or go to a doctor. Personally, I did it myself, and I'm planning to keep checking my blood pressure for the next couple of weeks. I'll try to do it on a daily basis, but we'll see how it goes and see if basically it drops down like to below the normal range. As I said before, I'm planning to start from 1.25 milligram once a day, so it's going to be quarter of a 5 milligram pill, and most probably I'm gonna be on this dose for at least 1 month. I will see. I'll start with 4 weeks and see how it goes. I'll monitor closely what kind of side effects, if any, I'm gonna experience. I'm gonna be checking my blood pressure, once in a while to see if it's in a normal range. And yeah, I'll make sure to, of course, update you guys on that. So yeah, make sure to subscribe if you haven't already. If you're curious, how it's gonna go, if you're planning to do it yourself, of course. But after 1 month, if everything goes well and I don't experience any side effect and my blood pressure is in a normal range and everything is well, basically, I'm gonna increase probably my dose to 2.5, so it's gonna be half a pill. Only because the higher the dose, the more effective it is. And I still want it to be pretty effective while pretty much maintaining like no side effect profile. How I'm planning to do it is interesting, actually. Since the oral minoxidil has a 6-hour half-life, and of course being a blood pressure medication, it lowers your blood pressure, I decided to start taking it early in the morning, first thing in the morning pretty much, but probably gonna take it just with my finasteride. It's gonna be so much easier. Let's say if I'm drinking alcohol, it's normally gonna be in the evening. And when you're drinking alcohol, while especially on this medication, it definitely can decrease your blood pressure. So I will try to kind of separate a little bit those things, take oral minoxidil in the morning, and it's gonna be more than 6 hours. Before my possible alcohol consumption, for example. So they will not like interact with each other, or they will not interact a lot, let's say. And of course, I'm gonna be definitely checking my blood pressure. For the first couple of weeks, I will try, to take in the morning and then have some alcohol in the evening, small amount, then maybe a little bit more, and just, check my blood pressure just to see how it goes. And yeah, of course, I think for me personally, it's gonna be like an experiment basically. And yeah, like I said, I'm gonna make sure to update you guys on that. If I'm gonna go to the gym, and go heavy while having some pre-workout, it's definitely gonna increase my blood pressure. I think it's a good idea to kind of separate them as well, just to kind of avoid unnecessary heart palpitations, for example. Right, so we're gonna start by cutting the pill. It's actually pretty small. If you're gonna have a look here, let's just take one of them. It's by Pfizer, by the way, Loniten. Come on. All right, pretty small pill. Let me take it out first. There you go. Really small. 5 milligram, and there is like a cut in a half here, but we're gonna cut it in 4 pieces. So since it's pretty small, I'm not able to cut to 0.625 to try out even smaller, hence why I'm gonna be doing it. Yeah, basic pill, a knife, and yeah, let's do it. Not a rocket science, to be honest. There we go. It's our half. Then we're gonna split into 4. Boom. There you go. 4 pieces, plus minus roughly. Gonna grab one of them and have some water.
Later that same evening, 12 o'clock midnight.
So I'm gonna be cutting only one at a time until I'm gonna use all of the pieces. So how I'm gonna be storing it, I got from Dr. Ferreira this little tiny like a pill, how do you call it? Like a pill holder, whatever. Yeah, I'm just gonna put here. Just gonna put here this 3 pieces. Maybe let's put in a different compartment so it's, yeah, so it looks stupid. And yeah, that's it. Basically, gonna be once a day. Nice and easy, and by the way, the pack is pretty big, 60 pills, so I got a 1 year supply basically. And last question that a lot of people are very curious about.
Where did I get it from?
Because it's a prescription medication off-label for hair loss, so it's really difficult to actually get your hands on it, let alone to get the Pfizer version of Loniten tablet. And I'll tell you just one thing. I didn't buy it, and I'm not gonna tell you where I get it from. I just know people. There are a few places that are more likely to prescribe you oral minoxidil should you want to try it, which include dermatologists or trichologists or hair transplant doctors. You could of course go to your GP and try to convince him to take this, but most probably he will not gonna be reluctant to do so, to prescribe it for you, because first of all it's off-label, it's not designed to treat hair male pattern baldness. A friend of mine actually referred to one of the dermatologists that is really good, and he's like 100% positive that she will prescribe to me if I'm gonna ask for it. Of course, after I'm gonna explain that, you know, I tried this and that, and I know exactly, you know, what to look, what to expect, and like etc. So yeah, that's probably what I'm gonna do after I'm gonna finish this one. But there are quite a few surgeons all around basically the world that are actually actively prescribing oral minoxidil. You just need to find in your area. So I always suggest to just contact them, just find, you know, all around you what kind of hair transplant doctors are there, and just email them and ask them, like, listen, are you willing to, are you prescribing oral minoxidil to your patients? And that's it. And like tell them, like, listen, you try topical, and you want to try oral, and you know all potential benefits and dangers of it, and you want to try it, and etc. Alternatively, like I said, you can find a dermatologist, trichologist. I would suggest as well to ask it beforehand, before going and like paying for, you know, their time, and then in the end they're gonna say no, they're not gonna prescribe it to you. And I also do not recommend to order oral minoxidil online. First of all, you really don't know where you're getting from, because it's a prescription drug, and if there is no doctor involvement, like you're gonna be taking from some random shady, you know, online stores. If the drug itself has some potential downsides, dangers in terms of side effects, you might as well get the best quality possible, you know, to kind of minimize the, you know, because you never know what you're getting. Let me know in the comments down below, what do you think about everything what we just discussed, and are you planning to start, or do you want to try oral minoxidil as well? What do you think the best dosage is? Share in the comments down below. And by the way, if you haven't subscribed yet, make sure to do it so you stay updated on this kind of videos, and as well to follow my second hair transplant, which is turning out pretty well, to be honest. I'm today day number 10, tomorrow I'm going to be posting day 11 video, which I'm going to be discussing how I'm, like, you know, I removed the scabs and how it looks, everything, and etc. So interesting updates. Stay tuned for that. And if you got any other questions, drop them in the comments down below, and I'll see you in the next one. Peace out. Yeah, basic. It's gonna go to bloopers.